Coronavirus disease 2019 or COVID-19 is an infectious disease caused by severe acute respiratory syndrome coronavirus 2 or SARS-CoV-2. SARS-CoV-2 is a new type of coronavirus that has never been identified previously in humans. Disease that attack the human respiratory organs and can cause a fatal effect and even cause death. COVID was first detected in China at the end of 2019. The first case of COVID-19 occurred in March 2020. Since then, the government has issued many policies to prevent the spread of COVID-19, as obligate to use a mask, wash your hands, and bring hand sanitizer. There is one only policy taken by the government, namely by holding the PLSD. PLSD is a period of large-scale social distancing. This policy has an impact on political, economic, social, cultural, defense, and security aspects. During the PLSD period, everything was done online, causing many workers to lose their jobs due to the closure of shopping centers and tourist attractions. In addition, with the work from home and online learning policies, online motorcycle taxis and other public transportation drivers also lost their livelihoods. After undergoing PLSD for about 3 months, the government announced a policy of the transition period from PLSD to a new normal. New normal is a period of transition or adaptation for people to return to their activities, but they are still carrying out health protocols to avoid COVID-19. Shopping centers and tourist attractions that have been opened during the new normal are considered infections because they cause crowds of people and will increase the spread of COVID-19 virus. The new normal era does not mean that the COVID-19 virus no longer exists. In this case, more socialization is needed for the community to really understand what the new normal is. Government policies were not yet matured when deciding to transition from the PLSD to the new normal era. It is evident that the lack of government supervision and the lack of public understanding of the health protocols has led to increased number of COVID patients in the new normal era. This policy may be able to restore economic stability, but this has led of worsening in the COVID case in Indonesia. In fact, when PLSD alone, the number of corona cases had overwhelmed the medical personnel. The government policy in classifying with cases of the spread of COVID-19 in several zones in the form of red zones, orange zones, yellow zones, and green zones is also considered less effective. With the zoning like this, people in the green zone will think that they are free from COVID even when they are not. Thinking like that will make people nervous and maybe no longer follow the reopening of schools in one of green zones areas, which in turn had fatal consequences and caused the virus to spread again. The government must also be more strict about health protocols in shopping centers and tourist attractions with a 50% limit on visitors. The government performance in handling COVID-19 must be further improved, and in addition to the government role, the role of community is also an important part of the effort to eradicate COVID-19. The community is expected to continue to act wisely and follow recommendations from the government and medical personnel. Don't think with the stigma that health protocols are not important and immune strength in